while we're talking about it, I'm going to answer some of the questions from previous sessions. I'm going to try. So, Katie Noble, if you're virtually, I know you were asking about the parathyroid and thyroid. So, and we talked briefly about thyroid yesterday, and Dr. Fish talked about thyroid today. I mean, again, if it's something that is becoming obvious, then we, of course, should be measuring it, at least not the parathyroid. The parathyroid, okay, let me just backtrack for a second. When we do bone studies, we do vitamin D, we do calcium, we do PTH, which is parathyroid hormone, and we do the alkaline phosphatase. So for parathyroid, we're good. Now, the thyroid part of it, we don't do it routinely. So I would probably say we would do it maybe in those that have more significant growth issues. And as far as how often, just like everything else, we probably don't have a good guideline for that. If it's normal, I mean, in kids with Down syndrome, for example, that are well known for having low thyroid, we do it once a year. So definitely not more than once a year. So maybe once a year, if really clinically it's indicated to be measured, that's no more than once a year. And then, okay, those were the things that I wanted to talk about. Happy to take any questions.
We have a few from the virtual, so.
She has. No, I'm just saying that you probably need the mic as well, sorry.
So 2 questions. Is this a database that our kids' medical providers could access to learn more about SAS, seeing as most providers know nothing aside from the printout that we give them?
Yes. So it is a public domain. I was playing with it on my phone. It's definitely optimized for laptop, desktop sort of platform. On the mobile device is not going to be as useful, especially because you have so many little clicks and whatnot. But yeah, it's a public domain, and anybody could use it for sure.
Great. And this next question is one that I know I get asked often. Is there any benefit to having kids who are already in the registry who receive regular specialty care to attend the SAS multidisciplinary clinic?
And I get that question a lot too. So that's up to the family, right? So when they come to see us, they see we humbly, I would say, we're the ones that had the most experience when it comes to the syndrome. So if you feel it's useful, by all means, and all we can do is provide recommendations. So except for maybe dental, when we sedate him and whatnot, and we feel like there's intervention that is going to be needed then, but even then, those patients go back to their local orthodontist to follow up, right? So we only provide recommendations. So if that's useful to the family, then of course, if they are, well equipped with a local craniofacial team, then maybe not.
Sure, great. One more came in. How do we participate in research projects? Do you need more SAS samples?
Yeah, so myself or our work at Children's, so for the ones that come to clinic, then all the protocols are in place to do the studies that we're doing. So we can collect samples and save them. We have a biobank, so that's just saving samples for future use, but those need to be seen in clinic. And then for the bone studies, we do them also when they come to clinic. If you're not coming to clinic, you're just outside, we're not set up at this point to do anything right now. Now, there's been, for example, for the metabolism study, I reach out to some of you, and we did the samples, like, hey, can you provide me with a sample? And you guys did, right? So if we need it, then we probably will approach you. But as of right now, the protocols are for localizing, seeing at our facility patients.
Okay. So I'm not trying to plan your life for you, but is there a likelihood or possibility that you could set up another clinic in Kentucky? Because I know for us, it'd be a lot closer than Arkansas.
Yeah. Is there a possibility? Sure. I mean, again, it's a matter of, training the rest of the team with like a speech and dental, psych group of people that are willing, able, and capable of seeing, patients. For our providers, if they see patients from one clinic, so 5 patients, they're already ahead of 99.9% of providers in the U.S. that have, awareness or familiar with this syndrome, right? So I envision that it might be the case, but again, I go with what everybody else tells me, like, oh no, I prefer to stay with Ashlyn because she's seen 50 patients than somebody that has seen 3, So maybe.
I told you in June we'd follow you anywhere. I didn't actually think you'd take us up on it.
Well, and again, I'm just such a small fraction of the input. Like, you guys need more input from psych and dental and whatnot than what I have to say. Yes, sir.
You had mentioned bone density and FGF23. Quest does offer testing for FGF23. Is it a different type of test?
No, it's the same. It's the same one that we would use for all the other types of rickets. It's the same testing. And I mentioned that because there's a specific treatment now. And in genetics, there's not many genetic conditions that have treatment, but there's a genetic condition that affects bone metabolism where FGF23 is the main culprit, and there's a treatment for that. So again, maybe there's more to come when it comes to looking at that. Yes, sir?
Hopefully a simple one, right? So on the portal, you had the, so you could input the protein input as well as the cDNA. You expect, like, both of them are in place? Would you get the same results if, like, for us? Okay.
Yeah, you can do either or. Now, what I noticed when I was doing it live, when I did the 715, on the right side, it didn't change it to 239. But the bottom did, right? So, but if you click search on either tab, it will give you the same results at the bottom. As long as if you're making a mistake, instead of the first 3 letters will be A, R, G, and instead of that you're doing something else, A, R, H, it's gonna display an error.
Okay.
Mm-hmm.
My question is about the QCT.
Mm-hmm.
So Lindsay has osteoporosis, and we've never checked for the spinal fractures. Would that be beneficial to ask for that instead of a regular CT?
It is a research-only test. In the U.S., I don't think clinically it's done at all, the
okay.
quantitative CT. And it is a portable version of a CT, much smaller than what you're familiar with.
Okay.
And we're doing it just in the arm. And again, we're trying to understand if that's better than doing the regular DEXA scan. So a CT for her, I will only do it if she had spinal fractures done, like on x-rays, if she had spinal fractures, that's follow up with a CT of the spine, because that will show you the fractures much better.
Okay, so first with the x-ray.
Yep.
Okay, thanks.
Yesterday, you briefly mentioned that, and can I ask a question from yesterday?
Yeah, of course.
That it was, the condition was, you thought might be more sperm-related than from the female.
Right.
And I was just curious about that, if you could go into more detail.
Yeah, I mean, and that's, again, as I was trying to explain yesterday, first, we haven't, for SAS, we have not looked at data of how old the mom or the dad were at the time of conception. We have not. Now, and this is known for, in genetics is known, there's ample literature that tells us that for autosomal dominant conditions, this is an autosomal dominant condition, meaning you just need one change in the gene to have problems, that happen brand new in an individual, which 99% of kids with SAS, that will be the situation. Again, most of the time, it's the sperm that is the culprit. We don't know why that is. And just like, Down syndrome happens more often on the egg side of the things because, as the females age, they're more prone to make mistakes, basically. So the thought process will be comparable, I guess, that as the sperm ages, they're more prone to make mistakes in terms of mutations and whatnot. Now, that research-wise, that could be done, but I foresee that will take a good amount of effort and money to figure it out, to confirm that indeed is mostly coming from the sperm. Yes, sir.
Yuri, I just had a thought. You were talking about stem cells. One source of stem cells is primary teeth. And should we be collecting those from all the primary teeth that we dentists are taking out on these patients?
I got that question just recently again, and you and I have really not talked about this because we could be collecting tons of teeth, but I don't know, myself, I'm not, we will need, obviously, somebody from the dental team with interest in research, PhD background, whatnot. I don't even know how to preserve the teeth for future research. It's not like you're gonna put it in milk for years, right?
They actually sell commercial kits to preserve the stem.
Yeah, so let's see, because I think that the biobank that we have, I don't remember if it mentions teeth, but that would be pretty easy to do for us. I mean, you guys have extracted tons of primary teeth. So it's easy to do, it's just a matter of how do we store it and where do we store it? I know where to store the blood sample because that ENT takes care of that. But that's more of a conversation for you and me to have, like, do we have the resources to store them? Okay.
Thank you, Dr. Zarate, for an amazing presentation and for all that you do for our community. Y'all talk about where we would be if we didn't have him. And he gave me the confidence to start this. So. We are a very fortunate group to have such an amazing team of clinicians and researchers that you guys have all heard from over the past 2 days. We have experts in fields. We're continuing to grow our network, have clinicians and researchers reaching out to us. I can't tell you how exciting things are happening. So much is happening behind the scenes, and we're going to go to big places, I promise you. So that is a wrap, folks. Enjoy. Thank you for being here. I am just so thrilled that over the last 2 days. So thank you.